India runs on stress.
The more stressed and anxious you are, the more problems you have with your gut-brain axis. Stress and anxiety are they mess up the signals between your gut and your brain.
People who say that they have a very good lifestyle, they're eating healthy, they're not alcoholic, they don't smoke, but still they suffer with acidity, gas, bloating.
We see something called silent reflux. So that means that you're not necessarily getting symptoms, but there is still ongoing reflux happening.
Right.
Some patients do not have symptoms till the very end.
What is the rightful method to consume protein powders? If it is not consumed rightly, what are the harmful effects for the same?
The best way to build muscle is to go natural. If you take them regularly, they can be carcinogenic. That means cause cancers.
Fatty liver, doctor. Of late, we see many youngsters having this problem.
This basically progresses in stages. So initially, fat gets deposited around your liver. This is where symptoms start presenting slowly. So you might notice some pain in the right side, feels a bit tender when you press. It's very important to pick up fatty liver disease at a very early stage. How do you do this?
Are there any peculiar cases that you've seen when it comes to endoscopy?
She had some mental health issues and things. So she swallowed 25. I've removed pencils, I've removed e-cigarettes. All these people who swallow things, they have a WhatsApp group. So I'm going to swallow pencils today. What are you going to swallow tomorrow?
Dr. Kalyan Peddada, welcome to the Honest Hour. It's a pleasure having you here.
Thanks, Shashank.
So I'd like to inform the viewers that you traveled all the way from UK for this podcast so that you spread some awareness amongst the people.
Yeah.
So how was the journey?
The journey was good. I mean, I'm quite tired, but otherwise it's okay. Thank you.
Yeah. So doctor, of late, there is one common question, that we hear across, different cross sections, whether it is students, whether it is working professionals, etc. People tend to say that I have stomach upset. Okay, I have some bloating issue. I have acidity issue. Or of late, there is something called as IBS and fatty liver syndrome. These are the terms, even on social media, we tend to see them at a regular scale.
Yeah.
So why exactly do you think that younger generation, people in their teens and early 20s also are suffering with this kind of problems?
This is a very good question. More than half of my patients I see in clinic present with similar symptoms which you've just told me. I guess the biggest culprit is today's lifestyle choices.
Oh, yeah.
If you go back, say, 50, 60 years ago, people used to walk from point A to point B.
Right.
They wouldn't take a bus or they wouldn't take their own car or a vehicle. And their diet was a lot more cleaner compared to what we are eating these days.
True.
I mean, there's just too much of ultra-processed food outside.
Packaged
food, pizzas, burgers, weird and wonderful dosas, cheese dosa, paneer dosa, mutton dosa, all sorts of dosas. And I mean, they've completely
also
spoiled.
Heard about something like a chocolate igli, it seems.
Yeah, exactly. I mean, I'm sure there's an ice cream dosa as well. So,
True that.
So eating these sort of foods, you're not doing your gut any good. You have trillions of bacteria in your gut. Okay. So it's like a busy city where you have good bacteria and bad bacteria. Having such unhealthy diets can lead on to a disproportion in your good and bad bacteria levels. What happens then? You get all these symptoms like bloating, reflux, indigestion.
Right.
Because you need a very good concentration of good bacteria in your gut to have a healthy digestive system and a normal digestive process. So the moment the good bacteria are not getting their required nutrition.
Right.
So what is their required nutrition? It's food rich in fiber, food rich in antioxidants, and easy to digest food. So if you're overloading your gut with all these ultra processed food, artificial colorants, artificial coloring agents, flavor enhancers, you're basically just destroying all the good bacteria in your gut.
Also, when we see very young kids suffering with these kind of problems, why do you think this is happening?
Most of the parents are trying to take an easy way out. Say your child throws a tantrum. One way of dealing with that is sitting down and promising something once they've achieved a task.
True.
The other easy way is the moment your child throws a tantrum, you just say, okay, I'm going to give you a chocolate. Here you go. Or okay, I'm going to buy you a pizza tonight. So kids these days are basically getting exposed to a very unhealthy diet right from a very young age. And the amount of fizzy drinks kids are drinking these days, and even your fruit juices, your so-called Tropicanas and all these, they have preservatives in them. They have flavoring agents in them.
True.
So by no means are they, although they say this is 100% pure.
Yep. That's
unless
it is
absolutely. So it's just poor lifestyle choices, I think. That's the main reason that all these things are happening.
Doctor, initially you were mentioning about endoscopy as a form of rightful diagnosis, and you're a prominent endoscopist, right? So, like, are there any peculiar cases that you've seen when it comes to endoscopy?
Yeah, well, we encounter a lot of weird and wonderful cases. Even just before I flew to India, I had a patient who presented to the hospital. She swallowed, I think, almost 25 razor blades. You know, your razor blades?
25 razor blades?
Yeah.
Oh my God.
She had some mental health issues and things. So she swallowed these, and she presented to hospital herself. She always swallowed this. And so we had to get her admitted and remove these blades very carefully under general anesthesia. So put the patient to sleep and do it in theaters. I got a CT done before just to make sure there's no perforation, because obviously there could be a hole in your digestive system when you've had these. Luckily, there wasn't. That was one case. And once I picked up, I had to remove nearly 10 small coins, which patients swallowed. These coins, yeah. And they swallow all sorts of things, they have it's mental health problems and things. I've removed pencils, I've removed e-cigarettes.
Oh my God.
So, yeah, I mean, these are all quite fascinating for, people outside and things, but it's, you have to be very careful when removing these, because anything wrong can happen. But yeah, this is and the more interesting thing was all these people who swallow things. They have a WhatsApp group where they kind of like have a common group, the swallowers group.
Oh, seriously?
So they share on there saying, "Oh, I'm gonna swallow pencils today. What are you going to swallow tomorrow?"
Seriously?
Yeah, it's ridiculous.
Could somebody be so crazy?
Yeah. I'll tell you another story. Yes, I had a patient on the ward. So she kept on getting admitted for bloody vomitings, and black stools. So bloody vomitings and black stools generally means there is upper GI bleeding going on. There's some bleeding in your GI tract. She had multiple endoscopies. All these endoscopies came back clear. There was no source of, and she had a colonoscopy as well from the bottom. That was all clear. Her hemoglobin was always stable, but every time you would have, you would definitely see a big bowl of red blood in the vomit bowl. So one day we were all very suspicious. We didn't know what was going on. Where is this coming from? My hemoglobin is stable.
Right.
So what she used to do, she had an IV cannula in. She used to open it. She used to drink her own blood and then fake up that she's vomiting her blood, just because she was desperate to get sedation for the endoscopy procedure.
Oh my God.
We see all sorts of crazy people in gastroenterology. But yeah, that's another interesting.
Any more peculiar cases that you can share with our audience? These are quite fascinating.
There's a long list. The other day I pulled out 5 charging cables from someone's duodenum, because they just swallowed your normal cell phone charging cable. So they just swallowed that. So I had to take those out in theater. And some people, especially homosexual people, they shove things up their bottom, and sometimes they get stuck. Like I had to remove a dildo once from the bottom. It was very, very difficult to remove, but luckily it wasn't as big as your standard size one. So but yeah, people come in with all these
things get
things.
stuck and they end up into the hospital.
Yeah, they present to the hospital. I mean, I think this the one with the dildo wasn't a deliberate kind of thing. It was accidental.
Yeah, correct.
I think they were playing too much hardcore, I think. And then it got stuck high up. And because if you don't remove it, the bowel is going to perforate. So you have to remove it. The only option is, if it wasn't endoscopically possible, then I would have gone for, patient would have needed surgery to remove.
So doctor, as you said, like it is a lifestyle problem as well as a social pattern which has evolved of late. Now, like if you could break up, these terms are used in a common parlance. What is the difference between IBS, like constipation, or acidity? These things are used in synonymously.
Yeah, IBS is irritable bowel syndrome. Okay, so IBS can present in different ways. So there's IBS-D for Delta, which is IBS diarrhea.
Achha.
And there's IBS-C. These patients present more with constipation. And sometimes you get those patients in the middle where they could either be constipated or lose stools. So it's very difficult to predict which route a patient would take, but they can present with all three. But they can present with all three.
So it could be a combination of all three also.
Yeah, absolutely. Yes. So that's what the last one is IBS mixed. So it could be either loose stools or constipation.
Achha.
Okay. So coming to a diagnosis of irritable bowel syndrome involves us doing a lot of tests. Okay. So basically we do certain blood tests to make sure they're not anemic. We ensure they don't have conditions like celiac disease.
Right.
We do some stool tests to see if there's any inflammation in the bowel, or if there's any bleeding in the bowel. Sometimes patients also need endoscopies.
Right.
Because before you label patients with the diagnosis of IBS, you need to make sure they don't have any pathology going on inside. Okay. And acidity is the same. It's the same principle with acidity. I mean, it's just the diets we're taking are just not helping it. Especially if you're eating a lot of spicy food, drinking a lot of alcohol, and there's mismatch in your good and bad bacteria levels, and all these things can lead on to acidity. So yeah, that's the main reason why we're getting all these conditions.
So, doctor, coming to acidity, like most of the Indian households, whether it is chest pain, people call it acidity. If somebody burps frequently, people call it acidity. When there is upper stomach pain, people call it acidity. If somebody is unable to sleep also, in Indian homes, it is called like, okay, you're suffering with acidity problem, that's why you're unable to sleep.
Yes.
Now, what are the actual symptoms of acidity and why does it occur?
Yeah. Again, this is a very good question. So it's very important to differentiate acid pain from a heart attack pain. Okay. Acidity can wait. If a patient having a heart attack does not, waits, he's going to end up dead.
Right.
So with acidity, you can get it presents in different ways. There's no textbook way of presentation.
Okay.
Most people, they notice kind of like a metallic taste in their mouth, or acid going up. They can actually feel the acid going up.
Yeah, so people call it acid reflux.
Correct, yes. And your gullet, so your food pipe feels very sore when you're eating things. You might be bloating a lot, passing a lot of wind from the bottom. So all these things are signs of acidity. The most important thing to remember is acidity, if unchecked, can go on to cause severe inflammation and thereby causing ulcers in either your stomach or your small bowel. And these ulcers can bleed pretty badly. I'll give you an example actually. I saw a patient not so long ago. He's been having acid problems for a long time.
Okay.
Elderly gentleman, about 70. He's also on some clopidogrel for a heart condition.
Okay.
So one day he started noticing that he's kind of vomiting up reddish like fluid. It wasn't pure blood, but it was more red tinged. And he was also passing black stools.
Okay.
So he thought it's not a big deal. Because he's been eating a lot of fruits these days and things. So he kind of neglected it. So the next day he collapsed at his house and an ambulance was called. And we noticed that his hemoglobin was about 60.
Oh my God.
Because he was having bleeding inside. So we did an endoscopy and we controlled the bleeding and then started him on a an IV drip of acid suppressing medication, and then he got better.
Okay.
So the reason I'm telling you this is you shouldn't be taking acidity lightly. Okay. So if you are getting ongoing symptoms, then definitely you need to see a doctor, because you might need changes in your lifestyle,
right,
or certain medications. Going back to chest pain because of a heart attack,
right,
again, this does not present like a textbook pattern. Sometimes, most of the times, what you would expect is left-sided chest pain. It's either going down your left arm or going up your jaw, and you get symptoms like breathlessness, sweating. You might feel lightheaded. So these are kind of your textbook symptoms,
right,
when you get a heart attack. But in patients, say for example with diabetes, they don't get these classic symptoms. They get what we call a silent myocardial infarction. So you're having a heart attack, but you don't know you're having a heart attack.
Got it.
So I think periodic health checks are very, very important. So everyone should get their ECG done. Everyone should get a certain set of blood tests done, just to make sure everything is in range and under control.
No, like people usually tend to take Eno, antacids, and some liquids, right? So when should they actually understand that it's time that they visit a doctor or do the rightful diagnosis? Are there any day-to-day symptoms that we have to notice?
I mean, we all get a bit of acidity now and then. I mean, if you've gone to a restaurant, eat a very spicy meal, you may get some bloating and also some acid reflux. But the things you need to watch out for are if this is consistently happening, regardless of whatever you're eating, or if you notice that you're finding it difficult to swallow, or if you're losing weight or vomiting up any blood, or you're having any abdominal pain.
Okay.
So these are generally what we call the red flag signs. So if you're getting any of these, then have a very low threshold to go see a doctor, because you might need blood tests, you might need an endoscopy, a gastroscopy. What are we looking for in a gastroscopy? We're making sure there is no inflammation, there is no ulcers, there's no blockages, because inflammation can cause narrowing, and this narrowing could also be due to cancer.
Okay.
So the only way you would know is doing an endoscopy.
But is it advisable to go for frequent endoscopies?
Oh, no, absolutely not. I wouldn't recommend a frequent endoscopy.
It has its own perils, right?
Absolutely, yeah. So if you got, say, for example, certain red flag symptoms, you're anemic, so you've got iron deficiency anemia,
right?
You're losing weight, you're passing a lot of loose stools, and despite you being on certain acid suppressing medications like omeprazole, esomeprazole, you're still getting these symptoms, then yes, definitely I would recommend having an endoscopy done. Because it's only after an endoscopy that we can tailor or adjust these medications accordingly.
Taking a cue from that, doctor, like what is that one symptom that people should never ignore when it comes to gut and digestive health? Because most of the people are either shy or embarrassed to talk about it. So according to your experience of interacting with a lot of patients.
So the most common symptom people, I guess, get embarrassed with is passing wind from the bottom, flatus. It's a completely normal phenomenon. All of us pass wind, so there's nothing to be embarrassed about. But at the same time, if it's happening regularly, this might be due to something else. So never be shy to go to a doctor and say, "Doctor, I'm passing a lot of wind from the bottom," because you might be having a big ulcer somewhere or something even more worrying.
The people who say that they have a very good lifestyle, they're eating healthy, they're not alcoholic, they don't smoke, or they go for regular exercise, right? And they eat millets and, healthy food, right? But still they suffer with the problem that you just mentioned, the gas problem, which is commonly called as acidity, gas, bloating. So why does this happen?
A very important thing to remember is what you see outside does not necessarily reflect what is going on the inside.
Okay.
Some patients have very obvious symptoms.
Right.
Some patients do not have symptoms till the very end. Okay. And some people, say for example, let's take a case of fatty liver disease, for example.
Okay.
You don't necessarily need to be overweight or have diabetes to have fatty liver disease.
Oh, there's some very lean people also.
Absolutely.
They have like grade 3, grade 4 fatty liver.
Just because your weight is within the normal BMI range does not mean that everything inside is going on well.
Right.
Despite a good diet, despite lots of exercise, yes, things can still go wrong.
Right.
We see something called silent reflux, silent reflux. So that means that you're not necessarily getting symptoms,
right,
but there is still ongoing reflux happening. Okay. So this is where periodic examinations come into play. Say, for example, you're getting your blood test done every year, just to make sure everything is within range. Getting some stool tests every year just to make sure everything is it's like a full body MOT. You know, it's like you taking your car for a check every now and then. I think you need to go to the hospital, get these tests done every now and then just to make sure everything is within range. Because sometimes, I'll give you a very interesting example.
Yes, please.
I saw a patient in clinic who has been getting reflux for a long time. He has been on acid suppressing medications. Sometimes they help, sometimes they don't. But
sometimes people are even addicted to these medications.
Oh yeah, absolutely. Just put down his ongoing acid reflux to something he's been eating every day. He used to drink a pint of beer every night after work, and he's not really had any major problems.
Right.
So, but one day his wife kind of forced him into seeing his doctor. So he came to see me.
Okay.
So because he's been getting ongoing symptoms, I organized a gastroscopy. So he did not have any problem swallowing.
Okay.
Let me just make this very clear. No problem swallowing. So I went in. There was a good going esophageal cancer.
Oh my God.
In this gentleman. The reason I'm mentioning this is you only notice symptoms like difficulty swallowing or food not going down at the very later stages. Early stages, you do not get these symptoms. But the damage that has to happen is still happening inside.
So what is imperative, or what the people or patients need to be careful is that they have to go for timely diagnosis.
Correct.
Or visit a doctor. And that's the least that you could do for yourself.
Yes.
Now, there are like many people, especially elderly people that we see, mid-aged people, that they suffer with tremendous problem of burping and gas. So they say it's normal. Like I just had some particular kind of meal today, so that is why it happens. But it is not just about that one meal. It's a constant thing. So why does that happen?
Yeah, I think. See, I mean, it's just
irrespective of what they eat, irrespective of what they do.
Yeah.
It's also socially awkward. It's a very recurrent phenomenon. Yes. So why does this thing happen?
Just like as we get older. Our skin ages, our hair ages, you get gray hair, you get wrinkles on your face. It's the same way the digestive capacity of your intestines might also reduce with time. So what you probably could eat 10 years ago, you probably won't be able to manage that same thing 10 years later. So it's very important to maintain what we call a food diary. So especially at that age group, basically, you see what is suiting you, what is not suiting you, write it down, try and avoid whatever foods are causing you symptoms. And as I said, periodic checks, make sure there is no deficiency in your iron, B12, folate, you're not anemic. Getting a stool test done just to make sure there's no inflammation in your bowel. And if you've never had an endoscopy, then getting an endoscopy might be worthwhile just to make sure there's nothing worrying going on.
Right. Now, coming to stool test, most of the people are very embarrassed or apprehensive also to take up a stool test. I mean, the Indian psyche, they think as if it is like, something unclean to do. And also this thing, going ahead from there, usually people have this flush and forget thing. But most of the doctors, they suggest that your poop or, is also a reflection of your gut health and your overall body health.
Correct.
Right. So your stool the shape, color and the texture of the stool is also an indicator of your health parameters. How far is it true?
It's 100% true. What people need to realize is there is no such thing as a textbook normal bowel habit. It's normal to open your bowels up to 3 times a day or 3 times a week.
Okay.
So it's very subjective.
Okay.
For example, my normal might be opening my bowels 3 times in a week. Your normal might be 2 times a day. What is more important is there a change in the pattern of your bowel habit? Say, for example, if you are opening your bowels twice a day and you suddenly start opening your bowels only twice a week. That's a kind of like a clue to say or hint to say something is going on. This is when you need to get investigated.
Okay.
And the consistency of the stool, the color of the stool, you can tell a lot of things. Say, for example, if you have very pale looking stools, that could be a possible sign of obstructive jaundice.
Okay.
So obstructive jaundice is basically, you've got these small tubes in your liver, which are draining all that bile into your small intestine. So if something is causing blockage of that drainage, you might be getting very pale looking stools. If your pancreas is not working very well, you might be getting some very watery, greasy loose stools. Okay. And if you got, say, for example, Crohn's disease or ulcerative colitis, you might see a lot of blood mixed in the stools and also some slime or mucus. So I know it's not very appealing to have a look at inside the toilet seat to see what's actually there, but I would definitely recommend everyone to have a look just to make sure there is no bleeding. The stools are looking normal. There is no mucus or slime, because especially inflammatory bowel disease, it's one of those conditions where you want to pick it up very, very early, especially Crohn's disease. It's a horrible, horrible condition to have. I mean, with modern medicine, there's been so many advances, but you need to diagnose it early.
Okay.
Because if left alone, things like Crohn's disease can develop very nasty complications.
Like so?
So you might be getting abscesses, basically. It's like infected collections inside. You might be getting abnormal connections between your bowel. And so I saw a lady not so long ago. She has a diagnosis of Crohn's disease with fistulae. We call it fistulae. Fistula is nothing but an abnormal connection between your bowel and any organ. So she had connections between her bowel and her urinary bladder, and also her bowel and the skin. So what happens is all the feces she passes, all the motion she passes, comes out in the urine because of this abnormal connection. And also there's fecal matter coming out from her abdomen.
Oh my God, it can get so bad.
It's horrible. It's nasty. I mean, it's very... it's not a pleasant sight to see, and I just feel so bad for the patients, because that's why picking up these things early helps us try prevent these things from happening. So have a low threshold to see a doctor if you're having any of these symptoms. Don't wait till that very end. Lots of people are scared about seeing a doctor, as you say, they're worried about what they're going to be diagnosed with or what tests they're going to need to have and things. But think of it this way. Why would you want to wait until a certain disease has progressed to that extreme when it might be a lot more easier and better when we pick it up early?
True that. Prevention is better than
Absolutely, yeah.
Now, I've seen a lot of podcasts of Dr. Pal. So he mentions about this gut and mind connection. So what exactly is that? Yeah,
so there's something called the gut-brain axis. Okay. So essentially, your gut and your brain, they're constantly exchanging signals.
Right.
Okay. So in a normal person, this exchange of signal is going smoothly without any problems, without any glitches. But in certain people, say for example, who have a lot of stress in life, who've had a lot of antibiotics and their good bacteria have been wiped out, or if they have a genetic familial history of irritable bowel syndrome, in those people, these connections are a bit abnormal. So your brain is telling your gut to do something, your gut is doing something else. Okay. So this is the anomaly in the gut-brain axis.
Right.
There are ways to improve or strengthen your gut-brain axis, So there's something called vagal nerve exercises, which you can all do.
How could you spell it for our audience?
So it's vagal, V-A-G-A-L, vagal nerve exercises.
Okay.
So your vagus nerve plays a very vital role in maintaining your good gut health.
Okay.
So many vagal nerve exercises you can do, deep breathing exercises, meditation,
Okay.
sometimes even like ice baths, chanting, whatever chant you want. All these things, they help strengthen your vagus nerve.
Okay.
And this in turn helps strengthen your digestive system.
How often should this be done, doctor?
Well, it's as frequently as you can, really. So I would definitely recommend do it every day for at least 15 minutes. Your focus will improve, your gut digestive health will improve, and overall, your overall health just improves. So, yeah.
So, doctor, another major segment of the society is the youngsters. So, most of the youngsters, they have a particular lifestyle pattern. Commonly, across different age groups, when we see, they are spending about 8 to 10 hours of screen time, whether it is for work or their own social media consumption. Secondly, they have a very lethargic lifestyle. They don't work out, they don't go for a walk and etc. They eat snacks at random timings, and then they go for midnight food, midnight biryani, or having a cup of tea or coffee at around 1 a.m. or 2 a.m. and stuff like that. Now, when they're questioned, they say that we are young, it doesn't affect us. We're not old to get affected and worry about health or digestive issues, etc. But inside the body, there's something happening, right? What exactly happens with this kind of patterns?
Yeah, again, this is a very important topic you raised. Look, lifestyle diseases don't happen overnight. Okay. So when I say lifestyle diseases, I mean heart attacks, diabetes, hyperlipidemia, all these things, they don't happen overnight. They gradually build on, and eventually one fine day they will just appear out of nowhere. Modern day lifestyle, I completely appreciate that they have a very busy pattern to their day. They have to go to work, they finish late. But at the same time, although this is not easy, you will have to squeeze in some sort of exercise and timely meals into your diet plan. Trying to cut out junk. For example, if you know you're going to be late at work, try and take a healthy snack with you, some fruits, some eggs, something, anything other than a burger or a pizza. And even if you're sat down, do some sort of exercise, just, move your legs, try and take the stairs, don't take a lift. I've been to a restaurant one day, it was just on the first floor. And there were stairs next to me. People would rather wait 30 minutes for the lift to come.
Okay. Yeah, that's
than take the stairs. I don't know. I mean, they feel probably it's a prestige issue if they don't take the lift. I don't know. But so every opportunity you have, just try and exercise. Small things. Take the stairs. Just as I said. Make sure you go and walk somewhere rather than taking a bus. If it's walkable, obviously. I'm not asking you to walk 10 miles or 10 kilometers, but because although it is difficult, you have to do it. Otherwise, you're going to face the consequences. Because that's what we're seeing. We're seeing diabetes in 20-year-olds, 30-year-old patients. We're seeing hypertension. And the pollution outside also isn't helping, Even if you are a non-smoker, with the amount of pollution that is there outside, this is equivalent to, I read somewhere that you're kind of smoking 20 cigarettes a day just by breathing this air.
Yeah.
Because that's the degree of pollution we have. Absolutely. So taking all these things, there is no easy way but to squeeze these things into your day-to-day routine. Somehow or the other.
So the timing of the meals, that should also be certain, right?
Absolutely. So what I always suggest my patients is try not to eat anything 4 hours before you go to bed.
Okay.
For example, if you're about to sleep at 10 o'clock, your last meal should be at 6 p.m. and no snacks afterwards.
Right.
And try and go for
Snacking is like a fancy thing.
No, this is the thing. So if you end up snacking late at night, what's going to happen is when you're sleeping, your gut motility isn't the same when you're exercising. So exercise always improves and increases gut motility.
Okay.
The moment you are sat down and not doing anything, your gut slows down. So when your gut slows down, your digestion isn't good. And when your digestion isn't good, your insulin resistance, all these things get worse, and you end up getting problems like, you become overweight, you get diabetes, you get bloated, your bowel habit changes. So try not to eat.
Yep.
I know it's tempting to go for an ice cream at 11 p.m., but maybe have it a bit sooner. I think try and leave a 4-hour window before you.
What's your take on this new fad, intermittent fasting? Is it advisable? Because I've seen like mixed responses and mixed opinions on the same.
Yeah. I think so. I've done a talk on this on my own Gastro channel, Gastro Shots. So 1 meal a day diet plan, it's called. It's OMAD. Absolutely fantastic. I'll very briefly tell you why it's so good.
Please.
Yeah. So we take a 23-hour window. We split it into segments. First 4 hours after you've had a meal, your body is digesting all those carbohydrates. Your insulin levels are high. So you have so much of glucose to use. All this glucose is going to your brain and everything is going fine. After 4 hours, after your last meal, what happens is slowly your glucose levels normalize. Your insulin levels drop. All this excess fat is being stored in your liver and your muscles as glycogen. Okay, glycogen. So if you're continuing your fast, after 12 hours, what happens is your body needs energy. It doesn't have any more glucose because you haven't had a meal after that.
Right.
So what it does,
burns it.
It burns the glycogen. And uses it as energy. Yeah. So roughly about 16 hours, all the glycogen is also used up. Now what happens is your body starts using fat as energy in the form of ketones.
Right.
Ketones are like superfuel. It is the cleanest energy you could ever have. Compared to glucose, ketone is much, much cleaner. You feel so much focused, sharp. Your fat is being burnt away. So your body is using ketones. When you hit 23 hours, that's when you need to have a very nutritious meal. So I don't want you to go and fast for 23 hours and go have a pizza and a burger.
People also tend to do binge eating, once they do a fast.
Absolutely. So it doesn't make sense.
Yeah.
So because, at that point, at 23 hours, your body is like a sponge, a dry sponge. Whatever you give, it's going to soak it up.
Right.
So if you give your body a nice meal, say for example, eggs, salad, if you're a meat eater, grilled chicken, yogurt, all these things, they do a lot of good to your body.
Something like it should be a balance protein
absolutely.
and carbs.
Yes. Yeah.
I think Bollywood director Karan Johar has promoted it to a great extent.
Absolutely, yes.
OMAD,
yes. So I think it's not for everyone, especially if you got conditions like diabetes. You need to do it in a much more supervised way. Yeah. And the other thing is you don't expect results with this overnight. This is a process. The first 1 week or so, you'll be feeling so horrible in yourself. You'll be getting hunger cravings and all these things. But these hunger cravings you're getting are not real hunger cravings. That's your brain trying to kind of, your brain is used to a certain pattern.
Yep.
It's been 4 hours. You've not had anything. Go and get a paratha or go and eat something. Yeah. It's not because your body needs energy. Your brain has been spoiled in that way.
Subconsciously
it's used to getting fed every 4 hours. So it's a wonderful dietary method, but it takes time.
It should be done in a proper monitored manner. With expert advice.
Absolutely.
Because some people just try to watch some Instagram reels or some YouTube shorts and try to do things on their own.
I can't do that because everyone's body is different. Everyone's calorie requirement is different.
Exactly.
Everyone's protein requirement is different. So it's not like one size fits all.
True that.
So you need to go to a good dietitian, get a proper diet plan, and then, but don't do it by yourself.
True that. Doctor, another common phenomena, we see a lot of people posting pictures on Instagram and other social media platforms. They look very healthy. They have, good chiseled abs. Okay, they post some workout pictures and all that. But suddenly we see that they're suffering with some health disease. Okay. Now, as per your experience, people who look healthy, are they also healthy within?
No, not necessarily. I mean, as I said, looks outside doesn't mean the same thing is going on the inside. Some people just present late with symptoms. Some people are just, they're quite tough in themselves.
Right.
Like some people begin to express their symptoms even when they are very small. But some people, say, for example, even if they're feeling very nauseous or having a lot of abdominal pain, they just put it down to something else. So this is where again periodic checks come into play.
There's also this thing like they say like we are working out regularly, right? But I cannot change my lifestyle. I need to party every day. I need to have alcohol or whatever intoxicants that they take. But I work out, so I'm burning it out, or I'm having detox drinks and etc. Or that's how I'm able to maintain myself. So the physical appearance is good, but the health habits are like this. So in that scenario, now these people are having a justification that they're balancing it out. So what is your take on this?
No, I mean, just because you have a six-pack ab doesn't mean everything is well and good inside. See, you get abs because you're having protein and you're working out. Okay. That doesn't mean you are getting the right amount of nutrition that you need. It's not just protein that your body needs. It needs fat-soluble vitamins, water-soluble vitamins. It needs fiber. It needs a lot of other things. So just because you're muscular doesn't mean, we've seen so many bodybuilders and other people die at quite a young age. Technically, going by this logic, just because they're a bodybuilder, they need to live till 100. So why isn't that happening? That's because your body, so there's something called oxidative stress going on in your body.
Okay.
There's a lot of free radicals being generated because of the unhealthy diet we're eating, lack of exercise, and all these things, they don't present until quite at a later stage.
Right.
And this is, if I may use the word, this is probably a bit of arrogance from the youngsters have these days. Just because they're young, they feel they can do anything. They don't really give too much of thought for what the future is going to be. Because if you don't look after yourself today, in 20 years' time, you'll be running behind doctors and hospitals. So I think everything has to start at an early stage.
Now, like coming to fatty liver, doctor, of late we see many youngsters having this problem. Why do you think this is occurring?
Fatty liver disease is a very, very common problem we see these days. Once again, it doesn't necessarily mean that you are obese. You could have a normal weight and still have fat deposition around your liver.
Now, once a person is diagnosed with fatty liver, they're like, is it permanent? Am I finished? So like one curious question is, can it be reversed?
Yes.
Right?
So fatty liver disease itself, so again, this basically progresses in stages. So initially, fat gets deposited around your liver, and that's what you call fatty liver disease. And this is
it only because of alcohol or any other reason?
Anything, alcohol, unhealthy diet.
Also can get
absolutely, yes. So you could have genetic conditions where your blood lipids are high. And in these cases, you could have fat deposition in your liver. Alcohol, conditions like diabetes, kidney problems, all these things could lead on to fatty liver disease, having a poor lifestyle. Fatty liver disease itself may not present with many symptoms. It's just there, that's it. Fat is around your liver and you don't have much in terms of symptoms. If this process is going on, your liver tends to become inflamed. That's when we call it hepatitis. This is where symptoms start presenting slowly. So you might notice some pain in the right side, feels a bit tender when you press. So all these things are because of hepatitis. Hepatitis is nothing but inflammation in your liver. Yeah. This stage, if it continues to progress, can lead on to scarring.
What do you mean by that, doctor?
Yeah. So scarring is basically your liver is so much inflamed. Let me give you an example. So if you notice a cut in your hand or anywhere in your body, what happens? It heals. In the healing process, you see more like a fibrous sort of tissue on there. Yeah. So the same thing is happening in your liver. Ongoing inflammation can lead to scarring in your liver. This is what we call fibrosis. Fibrosis at early stages can potentially be reversed through good lifestyle measures, lots of exercise, good diet. And there are some medications which are in research, like your SGLT2 agonists, which people use for diabetes, like semaglutide and things.
Right.
Fibrosis. So the final stage, if fibrosis goes to end stage, is called cirrhosis.
Yeah, liver cirrhosis.
This is a condition you do not want to have. I had a patient the other day when I was in the hospital. I was on call. He's diagnosed with liver cirrhosis. He was continuing to drink alcohol.
Okay.
So he presented with massive blood vomitings. We call it hematemesis, black stools. His blood pressure was, when he presented to hospital, was 70/50. So I was in shock, hypotensive shock, because he was bleeding and his abdomen was like this. That was because of all the fluid being accumulated inside. So when you have cirrhosis, you can get a lot of fluid inside your tummy as well. We call this ascites. So this fluid can get infected as well. We call it bacterial peritonitis. So it's a medical terminology, but it's so cirrhosis can present with lots of complications, and there is no cure for cirrhosis.
No cure.
As in, it cannot be reversed. The only solution is to do a liver transplantation.
Oh my God.
And liver transplantation comes with its own set of hurdles and problems.
True.
Because it's not like you've had a liver transplant, that's it, end of story. You need to be on immunosuppressant medications. These put you at risk of infections. Sometimes the transplant could fail and you end up with other problems. So it's very important to pick up fatty liver disease at a very early stage. How do you do this? Through scans, blood tests, and there's a test called FibroScan where you can actually check the stiffness of your liver. So all these tests are very important because if it's in the early stages, through rigorous diet and lifestyle changes, you can reverse. Yeah.
So basic dietary changes and treatment is sufficient for it to be
in the early stages. Yes.
So doctor, if you had to give 3 practical changes to a patient with fatty liver, what would those be?
Yeah. So number 1 on the list would be weight loss.
Okay.
So try and get into that healthy BMI range. Okay. So healthy BMI is anywhere between 18.5 to 24.9. So if your BMI is within that range, it's good. Number 2, eat lots of fruits and green leafy vegetables. Try and completely cut out processed foods, ultra processed foods, junk food, which are very rich in saturated fats. And number 3, avoid insults. So when I say insults, anything like alcohol or certain antibiotics can also cause liver injury. So trying to avoid antibiotics when they're not needed. And certain herbal medications also cause liver problems.
Is it so?
Yeah, absolutely. So I've seen patients having herbal remedies. They presented with acute liver failure. So it's a very recognized cause of liver failure, acute liver failure in medicine. So all these things, I think if you do them, then yes, fatty liver disease can be reversed. Yeah.
Doctor, now let's enter into the Indian kitchen where a lot of confusion and arguments take place. Now there is a debate stating that Indian food is spicy. and that causes a lot of acidity. The key ingredients which are used in Indian cooking, those cause acidity. How far is it true?
See, even spice to a certain degree is good for you. Okay. So you've got green chilies and red chilies. Okay. They generally have a chemical called capsaicin.
Okay.
So in certain amounts, it's actually beneficial for your body. It has antioxidant properties, and it helps boost immunity and other things. But obviously, you don't want to overdo anything. There's a saying, it's not the medicine that's a poison, it's the dose.
Right.
Yeah. So anything in moderation is okay. But say, for example, you're already suffering with a lot of gastritis and having reflux problems. So in those situations, I would try to avoid spice, because all that is going to do is just flare up the situation and make it worse.
Doctor, coming to oil, ghee, butter. Now, we see a lot of information in the web. Some people say that ghee is extremely beneficial. It has a lot of therapeutic properties. Now, there is another debate against it as well. So how does it work like?
Yeah. I mean, if I were to make something, I would rather use ghee compared to an oil.
Okay.
The principle is the same. Anything in moderation is okay for you.
That's a catch.
Yeah. Just because
Not
ghee is good
things
for you, you can't have a glass of ghee every day. That's going to shoot up your cholesterol levels and you'll end up with a heart attack.
I'll tell you something. Like, some of the people who are like into fitness and gymming, I see some youngsters having a glass of ghee, presuming that will actually help them in their muscle building. How true is that?
See, there's different dietary methods out there.
They also say it is going to give a good glow for the skin and stuff like that.
Your keto diets, and you got your intermittent fastings, and ghee your body needs a mix of nutrients.
Right.
It is not just fat or not just protein that your body needs. The problem is the moment you start giving it only fats or only protein,
right,
you will start showing up deficiencies in some vital vitamins, in some crucial vitamins and minerals. Yeah. So it's very important to balance everything.
So doctor, many people have strong chai or coffee on empty stomach. How harmful is it?
It's not an absolute no.
Okay.
But in people with, say, sensitive guts, I would suggest to have coffee after they eat something. But yes, you can have coffee on an empty stomach. It's not but the only issue is sometimes, especially if you're having a too strong coffee, then it might cause some irritation in your stomach and your small bowel. But otherwise, it's fairly safe.
Doctor, there are a lot of, there's a lot of information about black coffee. Now, some people say it is extremely beneficial. Some people say, if not taken in the right direction or in the right method, it could be harmful. So what are the benefits of black coffee per se?
Black coffee, personally, I drink a lot of black coffee. Okay. There are pros and cons to black coffee. Okay. So if you discuss about the pros, in general, black coffee without any sugar helps improve your focus, your concentration. It's a stimulant. So, it gets you ready for the day. It also has some antioxidant properties, black coffee without sugar. So in that regard, it's quite good as well. And there is some evidence to say that it delays certain conditions from developing, like Alzheimer's, dementia, Parkinson's disease, or even diabetes. And also some studies to say that black coffee is good for people with fatty liver disease as well, because it kind of speeds up metabolism. The downside to black coffee is obviously if you overdo it, your heart will not like it. So, you'll get irregular heartbeats. We call them arrhythmias. And also if you're constantly, regularly drinking too much coffee, your blood pressure might shoot up. So anything in moderation, I'd say probably 1 to 2 cups of black coffee a day is the right amount.
Not more than that. Now, there are some people who hit the gym, they take black coffee Right. They say that it acts as a fat burner. How true is that?
Because of its kind of, antioxidant properties, anti-inflammatory properties, it can help. But I mean, it'll be a myth to say that black coffee will just go and directly burn all the fat. It doesn't work that way.
Okay.
It kind of speeds up metabolism. So in the process, your body will start using up some fat.
Okay.
But it's not a direct fat law, fat
There's no
burn.
direct correlation.
It's not a fat burn drink.
Doctor, also in Indian culture, there's something called that having a chai after meal. Does it have any benefits per se?
I think it's more psychological than anything else. When you have a good meal, because tea is a lot more gentler than coffee. In some people, the tea kind of helps stimulate your dopamine levels as well. So you feel happy after having a cup of tea.
Right.
And it's like, it's just like a good mix after a big meal. So I wouldn't say there's any massive health benefits per se, but people seem to just enjoy a cup of tea after a nice meal. So it's nothing wrong in it.
Some uncles also say that, like, I have tea because it helps in fat burning. I feel relaxed and stuff like that. So there's no
I don't think so. No, at least, I'm not aware of.
Doctor, moving on, Rajma, chole, Urad dal, there's actually delicious and protein-rich foods.
Yeah.
But, people experience gasiness or bloating or acidity issues. Why is that so?
Yeah, I mean, because they're all very rich sources of protein. Okay. Some people find it difficult to digest certain proteins. For example, I'll give you an example. I mean, tur dal and moong dal.
Right.
If you want to cook tur dal, it takes almost twice the amount of time it takes to cook moong dal.
True.
Yeah. And the same thing is happening inside your gut as well. Certain sorts of protein are easily digestible. Say, for example, egg whites. Egg white is a fantastic source of protein and it's very easily digestible as well. Sprouts can be easily digestible compared to certain other things. Even in dals, as I said, moong dal is one of the most easily digestible dals. So it all depends on how strong your digestive system is. But certain types of pulses, yes, they do cause a lot of bloating. So the answer to that, or the solution to that, would be don't eat too much. And after you have a meal, just try and go for a brisk walk, just so that your gut starts moving forwards.
How about slow cooking and soaking overnight? Does it also aid in it?
Yeah, I think so. Yes, absolutely. Yeah. So if you soak things overnight, they just become softer, and it just makes it a little bit more easier for your gut to digest it.
Doctor, coming to curd and buttermilk, people say they act as coolants. But some people also argue that it will worsen acidity.
No, so buttermilk and curd are one of the best diets you could be consuming. Many reasons, especially live yogurts. They're full of they're just fantastic for your gut bacteria. So the very good source of probiotic. Even kefir, there's something called kefir.
Yes, I get that.
So that's very, very good for your gut bacteria. And milk and yogurts, they're also very rich in vitamin A, vitamin D. It's overall, I think yogurt is a fantastic choice of food for your gut health. And as long as you eat it in moderation,
right,
there is no significant harm associated with it. Some people might be lactose intolerant.
Yeah.
So in those people, you might notice that they're getting bloating or belching and things. But in such cases, you can, say, for example, go for oat yogurts or soy yogurts. So there's other formulations available. But yeah, I would definitely recommend everyone to have a cup full of yogurt every day.
Fantastic, doctor. So many reels say that, people who are having water along with the meals, they will face significant acidity and bloating issues. How true is that?
No, I think, again, that's a myth in my opinion, because you need adequate amount of water to digest your food. It's like, it's like building a wall. What do you put in cement? You put water, don't you?
True that.
Yeah. So it's the same concept. When you eat something, you need a little bit of water to moisten everything up, just to make it slightly easier for your stomach to swallow. And also, if you don't drink water when you're eating, what happens is there's a chance that the food can just stay in your food pipe.
Right.
So I'm not saying you drink too much of water, but
it's in moderation.
Small sips of water along with your meals is always good. It helps things move forward nicely. It provides the right amount of hydration that your stomach and your intestines need to digest food. So I don't see any problem in having water.
Before having food, is it advisable to have water, or after having food?
I would say along with food. The problem when you have too much of water before you eat is you feel quite full.
True.
Which is good in a way, especially if you're trying to lose weight. But bad in that regard that you probably won't be able to eat as much as you would have wanted to. So if someone is trying to lose weight, then yes, absolutely. You can have like 2-3 glasses of water before your meal, so that your stomach. So what happens is when your stomach is stretched for whatever reason, that might be air, food, water, it sends signals to your brain saying, that's it, I'm done. I'm not hungry anymore. So that's a good way of tricking your brain, drinking lots of water, to say, I'm done. I don't want any more food. Let's try and lose some weight.
That's quite some information. Doctor, like India runs on stress. There could be an aspirant preparing for competitive exams like UPSC, NEET, JEE, IIT exam, etc. And there are software employees who are under tremendous work pressure. And there are homemakers who have their daily activities. And everybody faces this stress and anxiety. Now, of late, when we see reels on gastroenterology, people are speaking about the correlation between anxiety, stress, and your gut health. How does it manifest?
Yeah, so anxiety and stress are big factors in how well your gut is functioning. Because the more stressed and anxious you are, the more problems you have with your gut-brain axis.
Okay.
So stress and anxiety are they mess up the signals between your gut and your brain. So what happens is you start suddenly feeling quite bloated. There's a lot of air trapped in. Your bowel movements are not as smooth as they used to be. So, and there's proven research showing that, things like deep breathing exercises, meditation, all these things help, one, reduce your stress and anxiety, and two, also improve your gut motility.
Now, doctor, I want to talk about something which a lot of people care about, that is their skin. Now, what is the correlation between gut health and skin? Because a lot of dermats these days are suggesting breakouts, acne, dull skin are also related to your gut health.
There's definitely a correlation between your skin and your gut health. Because your gut's good bacteria control the amount of inflammation that is happening in your body. So if you have an imbalance between the good and bad bacteria in your gut, your inflammation levels can be higher. This can go on to cause conditions like acne, eczema, and other things.
Rosacea, dull skin, etc.
Also, your gut is the major controller of your body's immunity. So if you have a weak gut, then you have a weak immune system. When you have a weak immune system, this manifests as various skin conditions as well. And the same thing, if there is good going inflammation in your gut, you're not absorbing all the vital nutrients that your body needs. So your vitamin A, D, E, K, zinc, all these things are not being absorbed.
Right.
And all of these reflect in how your skin appears.
Doctor, these days we see a lot of people going to the gyms and, posting pictures. Now, taking supplements and protein powders, most of them, though they might not have the inherent requirement for the same, given their bodily condition, seeing others, they want to emulate it. Right. So how healthy are protein powders? What is the rightful method to consume protein powders? And if it is not consumed rightly, what are the harmful effects for the same?
Yeah, we're seeing protein powders being used a lot these days, unfortunately. The best way to build muscle is to go natural.
Right.
The problem with protein powders is most of them have added sugars, added flavoring agents, And although it doesn't say on the label in the back, there could be traces of heavy metals like, arsenic, lead, which are, if you take them regularly, they can be carcinogenic. That means cause cancers. So I don't believe there is a need for protein powders. And also, if you use this in excess, there's also some studies saying that it can affect your kidneys as well, causing chronic kidney disease. So the best way is to go have things like eggs, sprouts, paneer. And if you're a meat eater, you can have chicken, fish, without obviously not too much of oil. So, but yeah, no, I'm against protein powders.
Dr. Kalyan, like you've chosen gastroenterology. Any specific reason for choosing this field?
Oh yeah, I mean, I think the love for it started off. So initially, I was in love with medicine because my father is a consultant physician in the UK. He's retired now, but he was my role model. So he motivated me to take up medicine as a career rather than surgery. And in general, I have very good hand-eye coordination, and I play a lot of sport like cricket, and I used to play a lot of video games as well. So gastroenterology is one of those specialties where you do a lot of practical procedures, like endoscopies. So that's what really attracted me to gastroenterology. And there's so much to choose from, You can choose endoscopy, you can choose inflammatory bowel disease as a special interest. You could choose ERCP, so when you remove gallstones, or you can simply do nutrition. So we see lots of patients who are underweight or overweight. There's bariatric surgeries, endoscopic bariatric surgeries going on. So there's so much variety to choose from. So that's the reason I opted for gastro.
Any peculiar case or any kind of adverse case that you've seen that made you regret why you've chosen gastroenterology?
I don't have any particular regrets about gastroenterology, but say, for example, patients with IBS can be a little bit challenging to manage. Certain patients, not everyone. Some people have very rigid mindsets, we keep seeing patients in clinic now and then. I think like over a month ago or something, I saw someone with very troublesome bloating and belching. The patient had stool tests and had a CT scan of their chest, abdomen, pelvis. She also had some breath tests to look for evidence of. We look for things like bacterial overgrowth, lactose intolerance. Everything came back negative, but the patient was still symptomatic. So in their head, they just wouldn't accept that this is probably irritable bowel syndrome, and we need to think about methods to conservatively manage using certain medications and things like behavioral therapy, meditation, input from a dietitian. You don't see such patients very often, I guess, but you do have certain patients who would never ever say, oh no, they just have this fixation in their mind that something is definitely wrong with them. So they can be a bit challenging to manage. In these situations, we ask usually colleagues for a second opinion to see what they think. But otherwise I really enjoy being a gastroenterologist.
So Dr. Kalyan, would you suggest young doctors to prefer UK?
Yeah, see, my personal experience, I can share it. For me, I've had a very good period of training because so we start in something called foundation training. That's kind of like your house surgency here. And then because I chose medicine, I did something we call core medical training. That's 2 years. And then my specialty training in gastroenterology was for 5 years. So that was roughly, my maths is correct, that's about 9 years of training. And the practical side of things and the shape of training, everything is fantastic. So I have zero regrets. I can't really comment on the standards of training in India because I didn't really do my post-graduation here. But yes, if people want to come abroad, then yeah, UK is a fantastic place to come and train. And they do need to keep in mind that getting into certain specialties might be a bit tricky, because of the demand the specialty has.
Right.
But yes, if they have plans to migrate, then they need to have very strong communication skills.
Yeah.
And try and pack your CV with lots of academic achievements, like papers and other things. So, but I mean, recently, as you know, the government in the UK has been making lots of changes with the threshold for people wanting to come in on a tier 2 visa. Right. So yeah, need to keep all these things in mind. But yes, UK is a really fantastic multicultural place to come and work as a doctor and train as well. So
yeah. When we talk about financial opportunities, how good are they?
Finances are okay. I mean, there's a myth in people that we abroad make a lot of money, but it's not necessarily true, because you end up paying a lot of money as tax. Right. So the savings and if you take into consideration the lifestyle, cost of expenses and everything else, you don't really save much unless, but there are opportunities to do extra shifts and things, so you can make extra money. It's not bad, but at the same time, it's not the same as, say, for example, the United States, where doctors make a lot more money compared to what they do in the UK.
So, doctor, finally, what is that piece of advice that you'd like to give any average Indian middle class person?
Health is the most important thing. It doesn't matter how many crores you have, how many cars you have, how many fancy bungalows you have. If you don't have good health, you don't have anything. So I think even if you have a very busy lifestyle, or if you are, just try and make some time for having good food, regular exercise, things like meditation and things. Try and stay away from doctors, try and stay away from hospitals, and start teaching your children good habits right from an early age. Don't let their tantrums kind of make you give in, and kind of you start buying them chocolates and cakes and things every time they cry. So yeah, good health, good habits should start early. Yeah.
Thank you so much, Dr. Kalyan, for making it today and sharing valuable insights, and also spreading the right kind of information, breaking the myths related to misinformation that especially people tend to believe when it comes to the gut health. I'm sure like this podcast and conversation will certainly help a lot of viewers do the right approach for their health when it comes to gut health and overall well-being. Thank you so much.
Thank you.